Perfect. All right, the Kahoot code is up. Go ahead and get started.
There we go. Now,
In. All right. Again, apologies for the delay, everybody. I was in a different meeting room and no one was joining, and I got very nervous, but I was in the wrong room. But you are in the right room. We'll get started here at 10 minutes after the hour. Go ahead and log into the Kahoot game. Should we listen to the funky Kahoot music? We have a vote for yes for the Kahoot music. We've got it up and running. All right, we'll get started in 5 minutes. 5 minutes. We'll start at 10 minutes after the hour. Frog legs, that's a good name. All right, we've got 2 minutes left for any latecomers, especially with our technical difficulties. And then we'll get started. All right. It is 10 minutes past the hour, which means it's showtime. So get those last minute join in and let's get started. So, welcome to Trivia for Summer 2024. First, just a little bit about our event. We are presented by the Pre-Dental Mentor Map, which is created by students of dentistry. I'll turn it over to Dr. Gallagher to talk a little bit about our sponsor this evening.
Hey guys, thank you so much everyone for coming out. This is our seventh event, actually. Good to note. We're already seven deep there, Steve. This is pretty
Lucky
good.
number 7.
We're getting there, yeah. And I just want to say with the students of dentistry team, Sean, Sarah, Dr. Roth, and I, we're happy to present this. We are presenting it also as a sponsor of the Predent Mentor Map. We created that as a service to help predental students have a free resource as they apply into dental schools, which is such a stressful time. We've all been there, and maybe some are here right now. And it's a free resource for pre-dental students to use. We're also currently building out a phase where we can get some compensation to current dental students. So to be on it right now, in the next 3 years and so on, we have several phases that are going to be major for everyone. We're looking to make this profession better as we go. Thank you so much for coming out, and we're looking forward to see who wins the 175 and $50 gift cards. 150 25 gift cards, that's what.
Perfect. Perfect. All right. So the rules, if this is your first time, although there's quite a few familiar faces on the call, there are 15 multiple choice and true false, and even today, some slider questions. We're mixing it up to test your oral pathology skills. Time and accuracy are important. So you want to answer accurately, but also as quickly as possible. There are 20 seconds per question. And of course, just a quick plug, these are our socials. Follow us there to stay up to date with any future events, especially trivia, which is coming to you quarterly. And just a quick plug, I am both on Instagram and YouTube, where we are currently live streaming. If you are on YouTube live streaming right now, just know that you are on a little bit of a delay. Because accuracy is important, you might want to take some time to switch over to the Zoom event, unless, of course, you are spectating. And if that's the case, then welcome. With that, let's get into a practice question, which is which option best describes you? Just so we know who's on the call. Are you a pre-dent, pre-med, or other? Are you a dental medical professional student, a resident, or a practicing clinician? Oh, we even have a little bit of game time music. This is interesting. All right. So we are dominated by pre-dent, pre-med, other, and then dental medical professional students with residents close behind. And only one practitioner. So we're all learners in this group, including the one practitioner. So we're all on equal footing here. So now that we've tested our Kahoot skills, we are ready to jump right in. So get ready for question number 1. What does neoplasia translate to? Is it new growth, new plane, frozen growth, or frozen plane? Let's turn the music down just a little bit here. New growth, new plane, frozen growth, or frozen plane? Very good. New growth, Neo. New plasia, growth. Very good. So, moving on. Let's check out our scoreboard. Aaron taking an early lead, but it's anyone's game. So let's keep moving to question number 2. What jaw cyst is most likely found in a patient with these hand findings? Is it the calcifying odontogenic cyst, the glandular odontogenic cyst, the odontogenic keratocyst, or the orthokeratinizing odontogenic cyst? On the hands here, you might see some red spots. These spots are pits. These pits are found on the palm of the hand. Therefore, they're palmar pits found in nevoid basal cell carcinoma syndrome. And we know that odontogenic keratocysts, or OKCs, are a component of that syndrome. So let's see how we're doing. Amy is up 7 places, our highest jumper, with Aaron taking the lead, but AA and AKT 1 close behind. I think AA might be our reigning champion, or at least from the leaderboard last round. So just a quick plug, if you need to review the nevoid basal cell carcinoma or Gorlin syndrome, there is a full video on my YouTube channel. But let's keep moving with a true-false question. The orthokeratinizing odontogenic cyst, or OOC, is less likely to recur than the odontogenic keratocyst, or OKC. Is that true or false? OOC, less likely to recur than the OKC. Is that true or false? This is, by the way, is a picture of an OKC in a patient associated with an impaction. So let's see how we did. The answer is true. The OOC has a recurrence rate around 2%, which is significantly lower than the OKC, which is notorious for recurrence, which is often why during treatment, additional steps are made, including the use of cryotherapy or trying to freeze the cyst lining, 5-fluorouracil or 5-FU, which is a chemotherapeutic agent, or a little bit more antiquated Carnoy solution, which is a mixture of different chemicals to try to kill that cyst lining to prevent it from coming back. But this was the closest question so far, so I think we may have a shakeup, but don't worry, still anybody's game. Let's see how things have shaken up. AA in the lead with AKT1 moving into second, Mish into third, and Asham into fourth. Michael Appa is our highest climber, up 6 places. Way to go, Dr. Appa. I think that might be an imposter, but we'll keep moving. So another multiple choice, which of the following conditions are associated with secondary amyloidosis? Amyloid is a protein that can get deposited in our tissues. Multiple myeloma, hemodialysis, chronic poorly controlled rheumatoid arthritis, or all of these answers. Secondary amyloidosis, this is a patient of mine with amyloidosis of the tongue. This patient had primary amyloidosis, which means there was no other cause. All of these, however, can cause secondary amyloidosis. Amyloidosis can cause macroglossia, a larger tongue, due to the deposition of the amyloid into the tissues. It also tends to look a little bit more yellow and is also a lot more firm. You can see in the tongue of my patient a little bit of yellow that you wouldn't expect to see in a normal, quote unquote, normal tongue. So let's keep the amyloid train rolling, but first let's see where our leaderboard is. Oh, we've got a shakeup. Mish pulling into third. David Kaddish is on the leaderboard for the first time, as is Lulu Lala, who I think made that name just to hear me say Lulu Lala out loud. Chris into fourth, and AA still on the top 5. Anyone's game early on. 6 players were knocked off their streak. That was a tough question for some people, but we're learning, so it's great. Our next question is also about amyloid, but it is about the microscope findings. What special stain is used to highlight amyloid under polarized light? Here's a picture of it. Is it Congo red, apple green, Nile yellow, or none of these answers? So you can see that this on the right-hand side of the picture is a positive amyloid, whereas on the left, the white that you're seeing is normal fibrous connective tissue. The name of this stain is Congo red. Some people may have said apple green because it's known to cause apple green light birefringence upon polarizing the light. It looks a little bit green when we do that, as opposed to normal tissues that look white. Nile yellow, I just came up with another river in Africa, another color. So Congo red is our answer. That's what we use to stain for amyloid in the tissues. Let's see. Oh, Lulu Lala is on fire with a 5-question streak. Chris entering our top 3 for the first time, and AKT1 holding on. Don't count AA out. AA is slowly climbing the way back up. So still early. Let's keep moving. What medication can cause this pattern of intrinsic tooth stain? Is it penicillin, omeprazole, tetracycline, or erythromycin? So intrinsic stain is stain within the body of the tooth. This is a very common pattern, not so much anymore because doctors advise against the use of tetracycline and doxycycline and other cyclines, as it can cause both tooth and bone staining. But yes, tetracycline, vast majority got that. Way to go. But did you get it quick enough? And we're staying constant. But some tough questions ahead, so let's keep moving. Now, this is a slider question. It's new. You're going to move the slider where you think the number is correct. What percent of oropharyngeal, that's throat, tonsil, behind the tongue, cancers are caused by HPV? So we have 0 to 100. Place your slider in the number that you think is most accurate. You do have quite a way of leeway. There's 20 percentage points on either end. So what percent of oropharyngeal cancers are caused by HPV? The correct answer is, depending on the study. Oh, that made that really suspenseful. So studies will say anywhere between 60 and 80%. If you answered between 50 and 90%, you got that question correct. A new thing, a new slider question. So we had 2 people get it spot on. That's pretty impressive. So let's see how we did with our first slider question. Oh, we've got a new shakeup in the leaderboard in our bronze medal standing. Long Peng is now in 3rd place. So way to go, Jella, back in the game with 3 in a row. Now, hope you got used to that first slider question, because here is another one. That was very suspenseful. What percent of oral cavity cancers are caused by HPV? So this is tongue, cheek, lip, things like that. Oral cavity proper, not oropharyngeal, caused by the human papillomavirus. What percentage? Go ahead and use that slider to put where you think between 0 and 100. Again, you are getting quite a bit of leeway. I believe 10 or 15 percentage points on either end. Let's see how we did, where our slider stacks up. We're sliding all the way back down. Where's that slider going? What is going on here? This is kind of crazy. The correct answer is 6%, 3 to 6%. We took anywhere between 0 and I believe, 15. So the key point here is that oropharyngeal, or throat, tonsil, back of the oral cavity, a large majority of those are caused by the human papillomavirus. But in the oral cavity, very, very, very few are related to HPV. In the oropharynx, HPV is a marker that it can be treated with chemotherapy and radiation, whereas in the oral cavity, HPV really doesn't mean much. The standard of care, that patient is going to be treated as if it was HPV negative. So this is a very important thing. A lot of people confuse HPV as causing oral cavity cancers, when really it's important to know for tonsil and base of tongue cancers. So this is a really, really important point. Either way, we still need to make sure that our patients are getting vaccinated. We've got Chris pulling ahead, dethroning Lulu Lala just for the time being, or maybe for the rest of the game, with AKT1 pulling back into the top 3. But we're still moving on. I think let's move on to question number 9. What is the diagnosis for this histology of a bump on the gums? Is it a peripheral ossifying fibroma, a peripheral giant cell granuloma, a pyogenic granuloma, or all of these options? So here we have some purple pink stuff in the middle of some cells. What is that purple and pink stuff? Well, it's bone or ossification. That is a peripheral ossifying fibroma. A peripheral giant cell granuloma, you're going to see giant cells that look like little chocolate chip cookies everywhere. We don't see that in this case. Instead, we see these bony islands. Therefore, this is a peripheral ossifying fibroma. In a pyogenic granuloma, you're not going to see bone, so that's out. But the 3 Ps are the differential diagnosis for the bump on the gums, and this happens to be a POF, or peripheral ossifying fibroma. So we definitely got some people with that one. Let's see if that affects our leaderboard here. We've got Long Pung back into the top 3, but Chris and Lululala hanging on tight. Congratulations to Abdullah, up 7 places, the highest climber right now. So we are heading into question number 10. So we are 2/3 of the way there, but there's still 1/3 of the game left with some tough questions ahead. So it is anyone's game. Which of the following psychologists, pictured below, died of oral cancer? Is it Ivan Pavlov and his dogs, Sigmund Freud, the father of psychology, Abraham Maslow and his hierarchy of needs, or B.F. Skinner? And I don't know what B.F. Skinner did. But who's pictured here who, even after his oral cancer diagnosis, still insisted on chain smoking cigars? He refused to quit the habit. It was indeed Sigmund Freud. The papers that I read that talked about his diagnosis stated that it was a squamous cell carcinoma or a verrucous carcinoma of the palate. He was made jaw prosthesis out of metal, which he really disliked. And unfortunately, towards the end of his life, he realized that his time was limited and actually asked one of his friends to give him a little bit of extra morphine. And that is what ultimately led to his demise. But he indeed had oral cancer. And it was terminal. And from the papers I read, it was squamous cell on the palate. But that was Sigmund Freud, who, even after his diagnosis, insisted on smoking his 8 to 10 cigars daily. Let's see how we did. AA back into the top 3, but it's tight. Look at this. It's about 300 points between our top 3, and then even less than 1,000 within our top 5. Congrats to James, who is our top climber that round, up 5 places. Way to go, James. Heading into the back end of our quiz, Men-2B syndrome is most commonly associated with which benign tumor intraorally? Neurofibroma, mucosal neuroma, schwannoma, or traumatic neuroma? All of these are nerve tumors, but only one of them is associated with Men-2B syndrome. This can often be found at birth, sometimes at the corners of the lip, sometimes between the front teeth, but indeed a mucosal neuroma is associated with Men-2B or multiple endocrine neoplasia syndrome type 2B. This patient was a baby, newborn, that happened to have it on the tongue. But oftentimes it's multiple nodules on the tongue, sometimes on the commissures of the lips, sometimes even creating a diastema between the 2 front teeth, or a gap. But Men-2B, the intraoral, is a mucosal neuroma. Uh-oh, we've got some sad faces. Look at the shakeup here. Lulu Lala and Long Pung moving up with Chris back into 3rd. And David Kaddish has entered the chat, pulling into 5th place on our leaderboard. Way to go. I hope that I'm saying that last name right. Sorry, David, if I'm not. Let's keep talking about Men-2B. Men-2B syndrome is most commonly associated with which thyroid cancer? Is it medullary thyroid carcinoma, papillary thyroid carcinoma, anaplastic thyroid carcinoma, or oncocytic carcinoma? It happens to be pictured in this histology that you see right here, which is the same patient, the baby, that I showed you last round. This indeed is medullary thyroid carcinoma, which you might hear during some TV commercials. They talk about, don't take this medication if you or your family has a history of Men-2B or medullary thyroid carcinoma. Now, oftentimes when Men-2B is diagnosed and the oral nodules can be the first sign, the thyroid is removed. Now, this is a baby, less than 1 year old, and they already have a thyroid cancer in their thyroid. So that tells you that these thyroid cancers can be very aggressive and can occur very early in life. So most people that have Men-2B syndrome get a thyroidectomy when they're at least a child, if not sooner. Let's see if we knew our Men-2B syndrome. All right, Asha making a comeback with 3 in a row, back onto the leaderboard. We've got some happy faces in our top 4, meaning they held their place. Looks like they know their Men-2B syndrome. Heading into our final questions, but it is indeed a close game here. We've got a little bit more than 1,000 point difference. All it takes is one slip up for the top of the leaderboard, and it's anybody's game. But we'll see if they can hold strong. Question number 13, speckled radiodensities of the sinus is suspicious for which entity? OKC, odontogenic keratocyst, mycetoma, inverted papilloma, or esthesioneuroblastoma. And this patient did happen to have this entity. These are all different, some neoplasms, some cysts, some infections, but what could this be? When you see these tiny radiodense grains in the sinus, you have to be worried about mycetoma. OKCs, inverted papillomas, and esthesioneuroblastomas are exclusively radio-opaque or radiolucent, or depending on the film that you get. But indeed, you can get some radiodensities or radio-opacities in the sinus if there is a fungus ball. So mycetoma is another name for a fungus ball, but we'll talk about that in a second. AA pulling into the leaderboard, and look at this Lulu Lala with 3 in a row, kind of solidifying that place at the top. Is anyone going to thwart Lulu Lala, or is Lulu Lala going to hang in tight towards the end there? Let's see how we do. So just a quick moment talking about mycetoma. Sometimes used to be referred to as aspergilloma, as most of these are aspergillus, but not always, and fungus ball. And yes, fungus ball is a proper diagnosis. You may see this on a pathology report, fungus ball. But yes, they can occur in the sinus. They're not invasive. They don't require systemic antifungals. Usually you just go in there, you scoop it out, and the patient's fine. And it can indeed occur and look like radio speckled little snow in the sinus. So it's something really important to remember when you're reviewing your radiographs for your patient. And under the microscope, it looks like a big ball of spaghetti. One of my favorite things to look at under the microscope. All right, second to last question. Which of the following conditions presents with elevated SCL70 antibodies? Sclerosing odontogenic carcinoma, sclerosing polycystic adenosis, sclerosing osteosarcoma, or scleroderma? All with that SCL in there, so I didn't make it easy on you. But which is associated with elevated SCL70 antibodies? Let's see how you did. Scleroderma, indeed. So if we think about this question, antibodies circulating in the blood are a component of autoimmune diseases. So whenever we can test for a circulating antibody, we can test for an autoimmune disease. We know that, therefore, this is an autoimmune disease. Sclerosing odontogenic carcinoma and sclerosing osteosarcoma are cancers. And yes, some cancers do have blood markers, but usually not antibodies. Also, sclerosing polycystic adenosis, very rare, doesn't have circulating antibodies. Scleroderma are related to the SCL70 antibodies, and that can be used to diagnose this autoimmune condition. Tough question. I saved it towards the end to see if I can shake anybody up. Let's see how we did. 10 people got it right, though, so that's pretty impressive. Asham pulling into second place, AA solidifying that third place right there, making a comeback, and we've got a shakeup. Lulu Lala cementing that first place, now up 1,000 points. So we're heading into our last question. And let's do it. What is the diagnosis for the histology of a nodule of the lip? So I'm going to show you this histology. What's the diagnosis? Is it a fibroma, peripheral ossifying fibroma, dermal filler, or a granular cell tumor? So we've got this removed from a lip here. Let's see if you know your histology to end the night. And the answer is dermal filler. So let's talk about that. The peripheral ossifying fibroma is only found on the gums, so you wouldn't find that on the lip. Fibroma is just going to look like a sea of pink, and granular cell tumor are going to be pink granular cells. Here, we can see this kind of gray material. That's the filler material that gets put in the lips to look like a celebrity, maybe Kylie Jenner, or it's very trendy to get lip filler for some reason. never mind. But you can see this here. This is actually Radiesse. Radiesse is the filler used here. You can see some chocolate chip cookie giant cells trying to eat up this external filler, but that is indeed a dermal filler. Oftentimes presents as a lumpy, bumpy lip, sometimes as a single bump on the lip. It can look like a fibroma clinically, but it is indeed dermal filler. Sometimes a patient forgets that they got it. Sometimes a patient is in denial or doesn't want to tell you that they got it, but we do see biopsies of dermal filler from time to time. And that right there was one of them. So before we get into our final standings, I do want to thank you all for coming. It was another successful trivia event. Again, don't forget to follow us on our social media platforms, especially our sponsor, which is predentmentormap, which is in the chat. Make sure that you follow that, as well as all of these. And be sure to tune in for our fall trivia. We'll be posting when that is coming up. So, shall we check out our leaderboard? Let's see. In third place with 9,801 points, Long Peng. In second place, Asham. And in first place, did she hold on to her spot? He or she, shouldn't assume. Lulu Lala. Congratulations to our top three, with Chris and AA as our runners up. If the three of you could send me a private message on Zoom or on Instagram, I will make sure to get your email to the team so we can get you your prizes. But thanks again, everyone, for coming out. I hope that you had fun. And more importantly, I hope that you learned something. Be sure to come back in the fall and bring a friend or two. And thanks again.
Another awesome one. Thanks, Steve.
Good work, everybody.
What are you doing this weekend?
This weekend, I'm going to Boston. So I'm pretty excited about that.
Oh, nice. Are you gonna hit it was Treehouse Brewing?
That's the plan. That's the plan.
Yeah. Nice.
Yeah. Give me 1 second. I'm going to end the live stream. All right. I'm still waiting on one email, I think. Yeah, I'm still waiting on Long Peng. I've got Asham and perfect.
Who recorded this, by the
I've
way? Was it Sarah or
I've got it. It's on my computer.
awesome, awesome. If we can get that into a drive or something, or even just share it with me, I'll be able to get that up on the podcast.
Perfect. Let me send this off to Sarah. All right, I've got everyone's emails. Thanks, everybody. Let me take a screenshot.